Hello. Today I am talking about developmental defects of the lip region. So first defect I am talking about is commisural lipids. You might have heard of commisural lipids. So what are commisural lipids? Okay, so commisural lipids. Commisural means, what is commisural? So commisural means that corner of the mouth. Okay, that corner where upper and lower lips will meet. Okay, upper and lower lips will meet here. So that is commisural. And pits you all know that it is a small pinpoint depression, very pinpoint depression type area. Okay, so we are talking about commisural lipids. So these are the pinpoint depression that is present near the corner of the mouth or the lips where upper and lower lips are meeting. So that is called commisural lipids. Okay, so what are these exactly? If we talk about them, they are small mucosal invaginations. They are formed by the mucosal invagination, means mucosa just folded inside. That's why it formed a pit shaped hair. So it's a mucosal invaginations occurring in where they are occurring in the corners of the mouth. Alright, so in the corners of the mouth, you might have seen in some people, not everyone will have, but in some people. So these are the developmental defects that are found on the corners of the mouth on the vermilion border. Okay, on the vermilion border of the lips. So these are found in the corner of the mouth. Now their location, because they are present in the corners of the mouth, so their location suggests there might be a failure of some fusion of some processes, right? So they are normal fusion. Whenever there is a normal fusion of maxillary and mandibular processes, it will form the normal structure. But here its location suggests there is a failure of normal fusion of which process? Here it is failure of fusion of normal fusion is not there, so it's a failure of normal fusion of embryonal, because it's taking place inside an embryo when embryo is developing. So at the time embryonal, maxillary and mandibular process, because here upper and lower lips are meeting, that corner is present. So it's a embryonal, maxillary and mandibular process fusion failure. Not fusion failure, it's a normal fusion failures. They're not normal fusion, it's abnormal fusion. So it's a failure of normal fusion of embryonal, maxillary and mandibular process here. Okay, so that is the cause of this to occur. Okay, so this is the region that's causing. So it's most commonly, obviously it will be seen in adults, most common to see in the adults, not in the children, but common in the adults, most commonly in the adults. So if we see it, approximately 12 to 20% of the population is affected. Only 12 to 20%, very less. Children, they might have, but the prevalence is not that much common in children. Children also can have this, but the range is very less, 0.2% to 0.7%, very less. Okay, although lipids are considered as congenital regions because they are the defects of the development time. Okay, so these are considered as congenital regions, but these numbers that they are occurring in very less amount in children, higher in adults, will suggest the invagination will develop later in life, although they are congenital, because it's a process like developmental defect suggesting it is congenital. But these numbers, they are suggesting that we have acquired them later in life, because it's common in adults. If it is congenital, it should have in children more, right? But here it is occurring in adults, so that's why it's suggesting it might be that we have acquired them in life later. Okay, so these are, now if we talk about males and females, it's seen most commonly in the males. Males have more chances than the females to have this lipids, commisural lipids, right? And family history, if there's a family history of autosomal dominant, so some cases it may cause that, right? Then coming to clinical features, what could be the clinical features? You can see in these type of patients which have commisural lipids. Now it's obviously it's not seen, so it's seen usually on the routine examination. Whenever I are doing routine examination, we can see these type of lipids because they are not producing any type of symptoms, that's why. So it is seen on the routine examination. and patient is unaware because he don't know, because he don't have any symptoms, so he don't know that it is present there, these pits. Now it can be unilateral or bilateral, means it can be present on the one side, or bilateral means on the both side. Okay, so it can be unilateral as well as bilateral. Or if we check check them clinically, we'll see they are not actual pits, they're just ending as blind fistula. Okay, so they end as blind fistula, or we can say they just not end. Actually, we see actually they just not end, they just manifest as a blind fistula. And what could be the depth of this blind fistula? Because they are going deep, so that they can be a depth of approximately 1 to 4 mm. So this is the depth of this blind fistula. Okay. Some cases there is a small amount of fluid that is expressed, like suppose if we squeeze the pit, right, we try to squeeze the pit, sometimes a small amount of fluid is also seen, but it not in all cases. In some cases fluid is also squeezed out. Okay, so that represents the saliva from that fluid is representing what it is representing, saliva from minor salivary glands, right? So here the minor salivary glands that drain into the depth of this invagination are releasing that fluid. So here the minor salivary glands, sometimes they may drain into the depth of this pit because they can go deep as 1.1 to 4 mm. So they can here drain some fluid. So sometimes whenever we squeeze the when we try to squeeze the pit, the fluid is released. It's not seen in all cases, sometimes. So it could be due to the minor salivary gland saliva is there, right? That could be drained. So it is different from paramedian lip pits. Paramedian lip pits means they are a different case, right? So these are of the lower lips mostly, but these are different from the paramedian lip pits. Okay, so if we talk about histopathological feature, what could be the histopathological features? If we check it in the microscope, because biopsy is not usually performed, it's rarely. Biopsy is rare in this case because it's not bothering the patient, and it's not like a harmful disease, right? So it's not performed for patient with commissural lipless. But still, if we have done some microscopic examination somehow, so what we'll see? So microscopic examination will see there will be a narrow invagination. Okay, we also see a narrow invagination there. Now which layer it is lined by? Narrow invagination, it is lined by stratified squamous epithelium. Stratified squamous epithelium. So epithelium here will be stratified squamous epithelium. Okay, and sometimes because their fluid is there, when we squeeze the saliva is coming out, so we can say the ducts of minor salivary glands are also draining. So we can see the ducts of minor salivary glands also seen, that may drain into this invagination. So this is all about this commissural lipids. This is a histopathological features. If we talk about the treatment plan, so now what kind of treatment can be given to the patient, because patient is even unaware of the disease, that it have that commissural lipids, because they are always asymptomatic, they are not producing any symptoms. So what kind of treatment can you give to the patient? And it is innocuous. Okay, so you will be requiring no treatment. So no treatment is required for this, unless until patient is not aware, he is not having any kind of problem with this, so we don't require any treatment. Okay, in extreme rare cases where the salivary secretion is very excessive from that pit, right? So in that case, or secondary infection have occurred, then in that case, extreme severe cases, in the extreme severe case. So what will be the extreme severe case here? When there is excessive saliva production, or we can say excessive salivary secretions is there from the pit, extreme, or secondary infection has occurred. In that case, we can we can advise surgical excision of the pit, only in that case. Otherwise, there is no treatment required for this commisural lip pit. Okay, so that is the case of the commisural lip pit.